Welcome back. Holiday travel in full swing as concerns over the new Omicron variant of the coronavirus grow. And we are joined by Dr. Jeff Pothof with UW Health, who's been with us for the last year and a half or more, talking about a number of stories. Doctor, good to see you again. Regarding the pandemic, let's just jump right in here with the rapid spread of the Omicron variant. Any new information at this point now that we've seen it circulating on the severity of the disease caused by this variant?
Nothing definitive, but I'd say, the early reports now, the data that we have coming in does suggest that it may cause more mild disease. Unfortunately, that'll be balanced by what looks to be a very contagious strain. So even if the percent of people who get severe disease is lower, the total number of people who may become infected may still drive hospital volumes just related to its contagiousness.
I feel like that's really where our concern is right now. Maybe a year ago we were concerned with, because nobody was vaccinated, with just the spread of the disease. But now it's really about overwhelming the hospital system more so, is it not?
Yeah, especially right now today, the health systems, ours included, are really at their breaking point. There just isn't that many more patients that we can take care of. And that's worrisome because it looks like the deck is stacked against us. We have this super contagious variant. We have the holidays coming up. We have influenza. And I understand, but I think the public's getting tired of COVID-19, and it's harder for them to do the things that we need them to do to make sure that we have hospital beds for people who get sick, whether it's COVID-19 or other illnesses.
Doctor, early on in the pandemic, I know we were talking about herd immunity as being something that could bring us out of this pandemic. As we're in the state, about 60%, I think, or so of the population vaccinated, and thousands of new people getting COVID all the time. Are we approaching that number that we need to reach for herd immunity? And I guess secondarily, are we reconsidering what herd immunity will mean in terms of the pandemic?
Yeah, like with lots of things in this pandemic, that herd immunity number is shifting. So when we're talking about native coronavirus, the ability of the contagiousness of that strain was such that if we got to, 70, 75% immunized, we'd reach that herd immunity threshold. Delta bumped that up. It was more contagious. So at that point, we needed 85% or so of people immunized. We haven't run the numbers on Omicron, but if Omicron is more contagious than even Delta, that would further bump up the number of people that would need to be immunized to get herd immunity. It might be in the 90% range, which I think, history tells us now that's not something that Americans are willing to do.
Let's talk about the children lastly, because you have a group of younger children who are eligible for the vaccine but are not yet eligible for the booster. First, your thoughts on that. And then secondly, what families need to do to protect their youngest ones right now who are not eligible for the vaccine.
Yeah, good questions. I do think we will see boosters for that group of younger kids. Now, the good news is that their immunizations are more current, so their level of immunity is still pretty high. I don't think that they're at tremendous risk of Omicron because they haven't had that booster, unlike those of us who were boosted, or immunized back in the spring. I think for families, we have to be a little bit careful for this holiday, and especially with travel. Fully immunized, boosted, that risk is lower. My concern there is less, with the exception is if you have folks who are severely immunocompromised or at risk for severe disease, you might want to think twice about that. Right now, the risk for the unvaccinated out in public is just exceedingly high. There's really no world that I can imagine that unvaccinated people should be gathering together in groups. That's going to cause problems for all of us.
Dr. Jeff Pothof with UW Health. Good to see you again, Doctor. Certainly appreciate your time over these last, what are we at, 12 months plus 10, right? 22 months or so. Appreciate it very much.
Yeah.